Hello, I'm Susan Goldberg, the Editor-in-Chief of National Geographic and Editorial Director of National Geographic Partners. I'm pleased to welcome you to our discussion of COVID-19. We'll look at the current state of the pandemic, try to forecast its future, and we'll look to the past at life-saving lessons we can learn now about plagues throughout human history. That's the subject of this month's cover story in National Geographic. Since the beginning of the year, this novel coronavirus has altered life as we know it. There are, of course, a staggering number of cases and a growing number of deaths. But nothing is untouched. Work, school, family life, milestones like graduations, and sadly funerals. Even the act of taking a walk or going to the grocery store can feel surreal. All of us pine for normal, and we're not done yet. Under the threat of this plague, we again look to science to save us. Today, we're watching in real time as scientists work frantically to defeat this invisible enemy. Many are optimistic that a vaccine will be available early next year. This feat, whenever it happens, will be the result of a collaboration of many heroes. So let's dive in. Join us behind our yellow border and hear insights directly from esteemed scientists, journalists, historians, and local leaders about the effort to tackle COVID-19 and how we can stop pandemics by more deeply understanding how we've dealt with history's deadliest outbreaks. We're honored today to have Dr. Anthony Fauci, the nation's top infectious disease specialist, here in conversation with ABC News correspondent Deborah Roberts, who will serve as the moderator for today's discussions. We'll also hear from Richard Conniff, writer of National Geographic magazine's cover story, Dr. Jennifer Ashton, chief medical correspondent for ABC News, Sikan Akpan, science editor for National Geographic, and DC's mayor, Muriel Bowser. On behalf of everyone at National Geographic, I'd like to thank you for joining us for what's sure to be an illuminating discussion. We hope you'll come away with new knowledge about pandemics and inspired by the work going on to fight COVID-19. And with that, I'll turn it over to Deborah.
Susan, thank you. It is a privilege to be here with you today and an honor. And thank you to National Geographic for hosting this urgent conversation. You know, they say knowledge is power, and we're going to begin today with the person most suited to make us knowledgeable about this current COVID-19 crisis, and that is the country's top infectious disease expert, Dr. Anthony Fauci. Now, of course, we all know him as a tireless and comforting figure who has guided us through this pandemic, but the truth is he's actually been out on the forefront diagnosing and treating serious immune-related diseases throughout his professional career. And he's also been a trusted advisor to six American presidents. So Dr. Fauci, welcome.
Thank you very much. It's good to be with you.
Well, we've begun this pandemic with so much fear, and now people have taken to greeting each other by first asking about each other's health. So let me ask you, how are you? Are you well?
I am well. Thank you, Deborah. I'm quite exhausted, but I have learned over the last several months that, adrenaline and purpose are pretty good energizers. So I'm actually, all in all, doing fine. Thank you for asking.
Well, good. We appreciate that because we certainly do need you. Let's start off by talking about where we are in this country. We finally topped, sadly, 5 million infectious cases. We're creeping up now, slowly on 200,000 deaths. One estimate said possibly 300,000 by the end of the year. Have we even come close to peaking? And what do you make of where we are versus where you hoped we would be when this whole thing began for us almost 6 months ago?
Well, Deborah, we certainly are not where I hope we would be. We are in the middle of a very serious historic pandemic. I mean, the numbers speak for themselves. I mean, you have 160,000 deaths and 5 million infections in this country. Where I hoped we would be, that when we had the peak that went up, in which we were hit hard, particularly in the northeastern part of the country, when the New York metropolitan area accounted for almost 50% of all the cases, hospitalizations, and deaths, But then what we saw was something that would be inevitable if we didn't do the kinds of things that we've been talking about intensively of late. And that is we did not have a universal, in the sense of everybody pulling in the same direction, of the kinds of things that can contain and slow down an outbreak. The things that we've spoken about: distancing, masks, avoiding crowds, outdoors better than indoors, washing hands, doing things like closing bars where appropriate, because that seems to be a hot spot of transmission. So when we went up, instead of coming all the way down to a baseline that is really workable, in the sense so that when you try to open the country, which we inevitably have to do, I mean, we can't just be locked down forever because of the deleterious consequences of that. So when we tried to open up several of the states, and we know right now, we've seen it, southern states, California, Florida, Texas, Arizona, they came back up so that in our baseline, instead of being way, way down, the way some of the European countries were able to attain, with a more uniform effort of keeping everybody on the same plane, we started to have an increase. So we went from a really very high, unacceptable baseline of 20,000 new infections a day to 30, 40, 50, 60, and even 70. Right now, we are turning the corner in that direction. And those states are having now less deaths, less hospitalizations, less cases. But when you look at other parts of the country, this is the thing that's disturbing to me, is that we're starting to see the inkling of the upticks in the percent of the tests that are positive, which we know now from sad past experience that that's a predictor that you're going to have more surges. So unless we all pull together to get that down, and we don't have disparities in some states are doing this and some states are doing that, we're going to continue to have this up and down. So that's the thing that I'm concerned about, because I believe we have it within our power to be able to get that down. Bottom line is, I'm not pleased with how things are going.
And we do have this patchwork of guidelines around the country. Some states have opened up a little bit, some not as much. Can we even begin to get Americans to get on board if we have essentially regions of the country that are operating in very different ways? I mean, how do we actually get a unified a response to this if we're not, we have states that are acting all very differently?
Well, that is a simple question, Deborah, but the answer is complicated because of the great divergence of opinions throughout the country and the independence, as it were, of the states and local areas of the kinds of decisions that they want to make. I have said over and over again, and that's the reason why I welcome a dialogue with you, Deborah, to get the message across that there are 5 or 6 things that if everyone at a minimum did that, we know from history of other countries, we know from what we've seen in our own country, that if you do that, you can turn around the surges and prevent further surges. And they're the things we keep talking about. I mean, there's not that difficult of the universal wearing of masks, the social distancing, the avoiding crowds, the outdoors, favoring things that you do outdoors versus indoors, washing hands, etc. The issue is that because of the divisiveness that we've seen in this country, we're having, I think, maybe understandable because of the differences, but unfortunate divergence where people say either lock down completely or let it rip, have crowds, go to bars. That shouldn't be that way. There is a golden mean in there based on the guidelines that we carefully put together about how you can open the country safely. Some people think that public health measures are kind of the obstacle to opening up. They're not. They're a gateway and a vehicle to safely opening up. Because if you follow the guidelines, the checkpoints, you start off by saying you've got to get past one checkpoint. If you do well, you carefully move to the other. That's a phase. You go to the next phase and the next phase. If you do that properly and carefully, and prudently, you won't see these surges. But yet, understandably, and this is, I guess, the nature of this illness, the nature of this infection is quite unique. I mean, you mentioned in the introduction that I have been involved in multiple outbreaks going back 4 decades, from HIV/AIDS to Ebola to pandemic flu to Zika, all kinds of different approaches. This is the only one I've seen where the range of impact on people is so extraordinarily varied. You have 40% or so of individuals who have no symptoms at all. So when young people, particularly, because there's no doubt about it, that statistically, young people do much, much better from the standpoint of any bad outcome than elderly individuals and those with underlying conditions. However, we're starting to see more and more that young people, even otherwise well young people, can get into serious trouble and even may have some long-term residual effects. But accepting the data that young people generally do well, there's an understandable and I guess somewhat innocent determination that if I were a young person and I got infected, I look around at my friends, they say, the overwhelming majority of them do just fine. So what's the difference if I get infected? I'm in a vacuum. I'm not hurting anybody. That's incorrect, because you are inadvertently and innocently propagating an outbreak that is killing some people. So even though you think you're doing fine and you're not deliberately trying to hurt anybody, the fact that you've been careless and not looked at the guidelines, that you don't want to wear a mask, that you want to be in a crowd, you get infected. And what happens is that almost certainly you or your friends and colleagues will infect someone else, who will infect someone else. And then someone is going to get seriously ill and maybe die. That could be someone's mother, their father, an immunodepressed child, any of those individuals who are susceptible. So you've got to appreciate, and I know it's tough to get your feel about that, but you've got to appreciate that not only do you have an individual responsibility to yourself, you have a societal responsibility to help us all get this outbreak under control. Because when it is under control, then you could start doing with much less difficulty the things that you really want to do. We could start to open the economy safely. We could get the jobs back. We can do all those things. But the nature of our country, of people having this independent feeling like, I don't want to do this because someone is telling me to do it, I guess that's understandable. And that independence is part of the core of our country. We like authority, but we don't like authority. That's getting us into trouble. And that's what I think the complexity of all of this is founded in, that inconsistency of what we're doing.
Someone said the other day, while the coronavirus isn't over, people seem to be over the coronavirus. Let's talk about some of these images that we have seen, pictures of people around the country in large locations, at bars, on beaches, without masks. Many people seem to just have an aversion to wearing masks, even though you and other experts have said that this is key. I read some statistic that said we could possibly save up to 70,000 lives by wearing masks. How do you get some skeptical people in this country to really understand the importance of wearing masks? And how long do you think we're going to be wearing them for?
Well, I can't predict, Deborah, how long it'll be. I know that right now, if you look at the numbers, they don't lie. You can't run away from the numbers. You can't run away from the numbers of people who've died, the number of people who are getting hospitalized, the surges we're seeing. It's going to depend on us. You're asking me a very valid question. How long we're going to have to be doing this depends totally on us. If we keep running away from the reality of the need to do it, it could linger on and linger on. You hear people talk about, well, you'll get herd immunity. So why don't we, let's just get a lot of people infected and then we'll be protected. If you do that, that is probably true, but a lot of people are going to die if you do that. So I think as a society, the ingrained in our human spirit, we don't want to really see that, because already more than 160,000 people in this country have died. Do we really want to see a lot more die? I don't think so. I think the other alternative is to contain it to the extent that we can until we get the interventions, which are on their way. Interventions like good treatments, interventions, hopefully, although there's no real guarantee, but hopefully that we will have a vaccine, one or more, because there are multiple candidates out there, one or more vaccines by the end of this year, the beginning of 2021. So this is going to end. So the idea of, if it's going to go on and on, let's just get it over with. No, we can be part of the solution as opposed to passively saying, just let it happen. I don't find that to be acceptable. We can do things without necessarily stopping all the things that are important. We can open the economy. We can get jobs back at the same time as still practicing good public health measures.
Let's talk about vaccines. Russia has said this week that it has actually come out with a vaccine now, that it's going to start actually inoculating people with this. What do you think about that? Do you think they've actually got this vaccine? And how close are we in this country to really having something? And how do we begin to dispense it?
Well, I mean, having a vaccine, Deborah, and proving that a vaccine is safe and effective are two different things. We have half a dozen or more vaccines. So if we wanted to take the chance of hurting a lot of people or giving them something that doesn't work, we could start doing this, next week if we wanted to, but that's not the way it works. So I hope, but I haven't heard any evidence to make me feel that's the case. I hope that the Russians have actually definitively proven that the vaccine is safe and effective. I seriously doubt that they've done that, but that's what I think people need to understand when they hear announcements from the Chinese or from the Russians that we have a vaccine, we're giving a vaccine, and people say, why aren't the Americans doing that? Well, because we have a way of doing things in this country that we care about safety and we care about efficacy.
How do you anticipate this will play out once we do get what we think will be a viable vaccine? Who will get it? How quickly will it be out there to the public? And will that put an end to what we're dealing with COVID-19?
Well, it depends on how effective it is. The vaccine statistical framework of it is to try and show that we have at least a 50% effective vaccine. I would hope, and it could possibly be as high as 60, 70, 75%. That's what I'm hoping for. Vaccines against respiratory diseases like this generally are not going to be as high. I mean, we know that from influenza, as high as what we say with measles. Like measles is 97 to 98% effective. I would hope that we could get that way. I don't think that's going to be the case. I would gladly accept a 50% to 75% effective vaccine. That would mean not that you could throw caution to the wind and do nothing else but get vaccinated. That means the vaccine would be very, very helpful and a very important additional tool, additional to public health measures, to get us out of this pandemic and back to a normal existence. So as I've said many times, I'm cautiously optimistic that we will have that. Now, your question about who gets it. Well, we have a standard way that have been done over decades of when you have a scarce intervention, particularly in the first months of distributing a vaccine as you're gearing up to get more and more doses. Ultimately, arrangements have been made to have enough vaccine for everybody in this country. But in the beginning, as we start to roll it out, what you do is you have advisory committees. The typical one is the Advisory Committee on Immunization Practices, which advises the CDC, who traditionally have had the task of making that determination of prioritization according to recommendations. This time, we're going to add an additional layer of that to complement that. And the NIH and the CDC have got together to commission the National Academy of Medicine to bring together an independent group of ethicists, biologists, vaccinologists, community people to look at the prioritization and to make a prioritization. We don't know what that's going to be, but likely, if it follows the path of other prioritizations, it'll be things like having people who are healthcare providers and frontline emergency responders, because they every day put themselves at risk, as well as individuals who are more vulnerable to serious consequences, such as the elderly and people with underlying conditions. Those are the kind of things that generally are prioritized, but we'll leave that ultimate decision to the committee and to the CDC.
I know you're a very busy man, but there are two topics that we need to get to. There are things that are top of mind for people right now. For parents, top of mind right now is their kids going back to school. You have said that you would like to see, of course, kids going back to school because they benefit from having this normal routine. But can we safely send kids back to school right now? Almost 100,000 children just in the last few weeks being infected with the coronavirus. We've seen incidents in schools in Georgia and Mississippi where they've seen an uptick in children who have gone back to school who've now contracted the virus. Can we safely send our kids back to school in person at this moment?
That's a great question, Deborah. And the answer is, as I think you've introduced it correctly, I believe as a default position, we should try as best as we possibly can to get the children back to school for all the reasons that you mentioned, the benefits for the children, the unintended negative consequences if we don't. But there's a big however there. And the however is, or the but is, that we make sure that the primary consideration is the safety, the health, and the welfare of the children, as well as their teachers, and the secondary effects of people they may come into contact with. What I really mean is that we live in a big country, and there are areas and regions of the country, the green zones as we call them, where the level of infection is low enough that you really should try very hard to get the children back to school, and there should be no reason not to do that. There are also areas, which we generally refer to as the yellow zone, where there are levels of infection that to get the children back, you should carefully follow the CDC guidelines. Everyone should be following the CDC guidelines, but looking at things that you can mitigate the likelihood that they're going to get infected and to know what to do if, in fact, you get an infected child. But you can probably get children back to school by doing things like modifying school schedules, maybe some outdoor classes, wearing masks, important, wearing masks, as I said before, and doing things like a possibly more physical separation, hybrid schedules, a lot of things. But finally, importantly, when you have a situation where you're in a red hot zone, where you have a lot of infection going on, I think you've really got to use judgment and carefully consider, do you really want to put the kids back in school under those circumstances? And I think many parents and teachers are going to vote with their feet on that. So again, big country, it's not going to be unidimensional. It's not going to be one size fits all, but we've got to be sensitive to the safety and the welfare of the children and the teachers.
We've seen these almost comical images of kids dressed from head to toe in hazmat suits to go back to school. Do they need to be masked when they go back to school wherever they are?
Yeah, I think it depends on, again, the level and the age, the level of infection. If you're in an area where there is active community transmission, I would recommend strongly that if the children are old enough to be able to keep a mask on, that you put masks on children.
What about voting? So many people are concerned. We're in an election year. Some people are going to be heading to the polls in the next few weeks. Can people safely go out and vote in person, given that this year there is so much concern around the vote?
I think if carefully done according to the guidelines, there's no reason that I can see why that not be the case. For example, when you look at going to a grocery store now in many regions and counties and cities that are doing it correctly, they have X's every 6 or more feet. And it says, don't leave this spot until the person in front of you left their spot. And you can do that if you go and wear a mask, if you observe the physical distancing and don't have a crowded situation. There's no reason why you shouldn't be able to do that. Obviously, if you're a person who is compromised physically or otherwise, or you don't want to take the chance, there's the situation of mail-in voting that is done for years in many places. So there's no reason why we shouldn't be able to vote in person or otherwise.
There is a lot of concern about this fall and this winter, whether we're going to see an uptick again in the coronavirus, the novel coronavirus. Look into your crystal ball, if you would, for me. A year from now, Where do you think we will be? Will we have this thing under control, or will we still be social distancing and wearing masks?
Well, that's going to depend on two things. That's going to depend on the success of vaccines. And like I said, although I'm cautiously optimistic, I've been doing this long enough to never, ever guarantee success when you're dealing with vaccines. But I think we would have a vaccine. So if you're talking about this time next year and we have a vaccine and we get the level of infection so low that we can successfully contain any little blips that occur and prevent those blips from becoming surges the way we have seen and are seeing in certain states, I think that we could be in a really good place this time next year. But a lot of it is going to be up to us as citizens to uniformly adhere to public health principles at the same time that we're fortunate enough to have good therapies and a vaccine that's effective. If we do, we will be in a good place by this time next year.
Dr. Fauci, your leadership has not come without some stresses and frustrations personally. You have talked about during the AIDS crisis how you got hate mail. And during this crisis, you have had death threats to the point that you've had to hire security. We saw such unity in the very beginning of this pandemic, people saying that we're all in this together. Now we're seeing a lot of anger. Did you see that coming, and where does that come from?
Yeah. Well, I just think it's a reflection of the divisiveness in the country. It has taken on a political tone like nothing I've ever seen. I mean, I've gotten people who are upset that I was putting effort on HIV/AIDS. I mean, a lot of that was people who were homophobic and felt I was diverting resources to people that they didn't think should be part of society. Obviously ridiculous. But that was never anything that was serious the way it is now, where people get angry enough that they threaten my life and terribly harass my wife and my children with phone calls. And I don't even want to talk about the things that they do, which, I didn't hire security. The federal government is providing it for me. It seems inconceivable. I mean, if you just think about it, take a deep breath and think about it, that when you're trying to promote public health principles to save people's lives and keep them healthy, that there's such divisiveness in the country that that's interpreted to be so far from your own way of thinking that you actually want to threaten the person. I mean, it's tough for me to figure that out, except to say, boy, I hope we get past this divisiveness in our country and get more down to, even though people have their different thoughts and different ideologies, that we get it out of the realm of such intense divisiveness that you start doing things like threatening people. That's just no way that our society can really function well and go along that way. We've got to get past that.
Well, you have been out there out front. You have been tireless in all of your work. I'm wondering, when you look back, if you had it to do over again, would you throw that same pitch at the Nationals game?
Well, I got to tell you, the motto of the story is, don't practice so much that you throw your arm out. I should have just got up and just said, okay, I haven't thrown a baseball in so many years. Let me just throw it. It was a little embarrassing, but it was actually kind of funny, Deborah. It was actually kind of funny.
It was fun. It was fun to see you, and my husband put me up to that, I have to tell you. Well, Dr. Fauci, on behalf of myself and National Geographic, we just thank you for all that you have done and continue to do to try to keep our communities safe. And we just wish you the best, and of course, wish us all the best as we try to fight through this novel coronavirus. It was a pleasure to talk with you and a pleasure to have you here today.
Thank you very much, Deborah. I really appreciate you giving me the opportunity to be with you. Thanks.
Now I'm privileged to be joined by a distinguished group of panelists, including Washington, D.C. Mayor Muriel Bowser, ABC Chief Medical Correspondent Dr. Jennifer Ashton, National Geographic Science Editor Sikhan Akpan, and author of the National Geographic Magazine August cover story, Richard Conniff. Welcome to all of you. It's so great to get a chance to see you. Dr. Ashton, I'm going to begin with you. I'm going to invoke the powers of nepotism, since we're in the same family, ABC family. I want to start off with you talking about Russia's claims that it has a vaccine. They claim that they are the first ones to actually get a viable vaccine. Putin says his daughter has taken it. What do you think the chances are that this is an actual viable vaccine against the novel coronavirus?
Well, I think it's definitely the shot heard around the world in terms of vaccine news right now. I think we have to remember that in science and medicine, a healthy amount of cynicism and skepticism is generally a good idea. When something sounds too good to be true in medicine, it usually is. However, we do have unprecedented global collaboration for the development of a SARS-CoV-2 vaccine, with a lot of developers doing really well and making good progress. Here come the caveats. As far as we know at this time, Russia has not completed or even really started comprehensive phase 3 trials yet, which usually involve the recruitment of tens of thousands of volunteers. And then we need to wait and see not just short-term, but long-term safety and efficacy. Until we see that in the scientific community worldwide, there will be plenty of people, my feeling is more rather than less, who are very, very cynical about this.
You echo the sentiments of Dr. Fauci, who says he's sort of wary about whether this is actually a clinically tried vaccine, but yet we do have some that are in various phases of clinical trials. What's your guess about how soon we can actually hope for a vaccine in this country?
Well, first of all, in medicine and science, history and past experience absolutely helps to inform our assessment or forecast about what could go on in the future. And just for some historical context and perspective, Deb, the fastest ever vaccine that has been developed in history took 4 years. So if we have dosable vaccine in any amount, whether it's 1 million doses or tens of millions of doses or eventually hundreds of millions of doses, any time before then, that will be a land speed record. Cautious optimism is the term that we've heard from the beginning. Dr. Fauci says that all the time. You've heard him say that. He's said that in conversations with me. And I think it's important to remember that it's unlikely that there will be just one vaccine. There are different types of methods and mechanisms being investigated right now, and several, at least 3, are in phase 3 clinical trials. So again, it takes a certain amount of time, and you cannot cut corners when you're talking about long-term efficacy and safety. The timeline is still the timeline,
as much as we may want it. Richard, let me turn to you, if I can. You have written extensively about the history of pandemics, including the August issue of the National Geographic cover story. And let's talk about where we are at this point in time and sort of contrast it. 800,000 deaths worldwide. We're creeping up, or we've actually surpassed in this country now 5 million coronavirus cases, creeping up to close to 200,000 deaths in this country. You talked in a very detailed way in your article about the smallpox pandemic, for instance, and just how devastating and debilitating this could be, but also trying to contrast where we are now versus where we were then, similarities in the public reaction. What have you learned in your research about what we can learn from history, and also maybe what we don't seem to learn from history?
So the big thing for me is that all of us who have been born since World War II have spent our lives in a bubble largely without infectious diseases and certainly without pandemics. And for me, this is personal because, well, World War II, after that, the antibiotics came in and eliminated a great many infectious diseases. But also you had this incredible outburst of vaccines, which continues to the present day. But it started in 1955 with the polio vaccine, and I was among the first people to get that vaccine as a grade schooler. And on the other hand, measles was epidemic when I was a kid. I was part of the worst epidemic year for that disease, 1958. There were 700,000 cases and 550 kids died. And the important thing to remember is that that kind of dying, that kind of sickness was really routine up until our time. And so we need to recognize what we've come through, what we got, and also what we've gotten away from. I guess the thing that is worth noting about that is that because we're free from these diseases, we tend to forget the consequences. We forget the diseases. I mean, even most doctors today have never seen diphtheria, which was still killing 400 people a year, 400 children when I was a child. Most people don't even know what diphtheria is, but it was called the strangling angel back then. And it would create this leathery kind of membrane that would bridge a child's throat and strangle a child. And it was highly infectious, and it would spread within a family from one child to another. And at one point, I visited a cemetery in Lancaster, Massachusetts, and there were 6 or 7 gravestones, and they were kind of leaning together like a family. And they were a family. They were the bodies of 9 children in the Morris family. 5 of them died within the first 11 days from diphtheria. 1 more died later that summer, and then 3 more died a few years later. And it was not uncommon for families to lose all of their children. So, because we forget, we have allowed our public health structure to deteriorate, and we have repeated warnings that there will be pandemics. But because it hasn't happened to us in our lifetimes, we've disregarded that, and we've actually dismantled public health services. So there was something called PREDICT, which was an agency that was designed to detect and prevent epidemic diseases, and it went out of business in October last year, about a month before the first COVID cases appeared.
We had sort of an attitude of unity in this country early on in this pandemic, that we're all in it together. Now there seems to be an attitude, at least amongst some people, of anger. Ignoring the guidelines and the protocols, not wanting to wear masks. Sikan Apan, I'd love to get your thoughts on that. The idea that people were really following the rules in the very beginning, and now you do see pictures of large gatherings and people not wearing masks. And Dr. Fauci has talked about his deep concerns about the fact that we've got sort of a hodgepodge of guidelines around the country, and that's not helping us at all in terms of trying to defeat this virus.
Yeah, I think it's a couple of things. I think for one, people are struggling with empathy. It's hard to, visualize how this virus is so devastating unless it happens to you, unless it happens to somebody in your family. And I think for that reason, some people are having a hard time saying, why should I adhere to 6 months of lockdowns? Why should I social distance when I want to be near my friends? Why should I wear this mask when it's preventing me from being able to breathe normally, and I'm not able to see my friends' faces. But I think we are seeing that this pandemic is devastating, right? We're seeing massive amounts of deaths. I think we're up to 160,000 deaths in the U.S. alone as of today, or as of this week. I think the other issue, you bring it up, this patchwork, right? Our coronavirus response wasn't 160,000. Yeah, excuse me. I think the other issue is this patchwork of our response, right? This idea that the U.S. response wasn't very unified. We haven't gotten the leadership that we might want for a pandemic like this in terms of the response. And so you see all 50 states sort of doing their own things, and then even on a more micro level, you see some counties doing different things. And I think when that happens, it becomes very hard to test, trace, isolate, which are things that we need to do, and also to get people to adhere to social distancing. When they're hearing mixed messages, it's going to be harder for them to trust the public health guidelines that they're hearing, and also to want to follow them, even if they really want to follow them, because they won't know what to do.
Well, Mayor Bowser, that's a perfect opening to you, because regions, mayors, governors are having to sort of set the standards in their communities. How do you, what guidelines do you adhere to? I mean, of course, we've heard the CDC issue guidelines. We've heard Dr. Fauci talk about his concerns. Where do you go for the guidance, and how are you handling the masks and the protocols in DC when sometimes you do run up against people who don't necessarily want to follow those rules?
Uh, well, thanks for that question, Deborah. And certainly, I think it's unfortunate that we have a patchwork of guidance across our country. I think that we've seen globally that countries that have acted in a unified way have been able not only to blunt the curve, but to contain transmission of the virus. And I think it was pretty clear to all of us at the outset that that was the only way to get back to normal the fastest. So what we're left with is this kind of idea that governors would solve the problem. And we're in Washington, D.C. I'm the mayor, county executive governor, and I don't have two senators, but that's another matter. And so we are left to look to the science and kind of act on our own. And realizing that our borders are porous, act within our region, the metropolitan Washington region. So we continue to do that. We have an excellent health staff that's guided by science, that stays connected with the other health directors in the region and the CDC to follow the best advice that we have. Now, I will say, I think everybody recognizes that the guidance that we started with at the beginning of this pandemic has evolved over time, and we have had to evolve with it. And what we continue to call on, though, I don't think it's too late, and we have to all be focused on calling our federal officials to the table. It's not too late to have a federal plan. To do a better job at testing and supplies and national guidance, whether it's masks or travel advisories or some guidance on testing, like when should people get tested, that would make better use of our testing infrastructure. And only when we're able to do that, up until we get a vaccine, do I think we'll get some rational policies moving forward.
And in the meantime, you're having to use your judgment right now during a period that is very difficult for parents, and that is going for their kids to go back to school.
Yes.
There is a patchwork of decisions. There are patchworks of decisions all around the country right now.
Mm-hmm.
Some school districts, the Los Angeles school district is going to remain online. The New York City schools, one of the largest in the country, is going to
Mm-hmm.
gradually open their doors. You're cautious
Mm-hmm.
about that, though, in your district. What are you going to do, and how did you make that decision?
It's probably one of the most difficult decisions in all of this because I, for one, know that online school is no replacement for school. Kids being able to learn with their colleagues, their classmates, and be in front of teachers. We know that teachers make all the difference in education. And so what we're doing at home is no replacement for school. And we have some tough decisions to make around what the health data tell us. But then you mix into that all of our workforce requirements and our workforce wanting to come back, as well as parents and parental confidence. So it's not just me saying this is what the health data show. It's also saying that we have workforce confidence and parent confidence. And then and only then will in-person school work. For us, taking into account all of those things, we decided to go online for the first term.
Dr. Jen Ashton, let me ask you about schools. Dr. Fauci has said, notably, that he thinks it's a good idea for us to start trying to open the schools again, particularly in places where the numbers are low, and to sort of go slowly. But we also know that there are a number of children over the last few weeks. We've seen 100,000 children testing positive for the coronavirus. High schools in Georgia and Mississippi, children have tested positive. In Indiana, in one high school, they actually had to go back online for a while. What do we know about children and their ability to transmit, and how worried Do you think parents really, how cautious should they be?
Well, Deb, I think first we have to start with what is known, what the available data and peer review evidence has shown us. And that is evolving day to day, like so much of what we know about this virus, just about 7 months into our relationship with it. What it appears right now is that the pediatric age group does get infected. They do transmit the virus. How much they transmit or spread it to others is still unknown. But they appear to be less likely to get severely ill. Now, a lower risk does not mean zero risk, and that's a very important distinction. This is a unique population. But as we segue from the medical and scientific to the more societal and social and emotional aspects of this decision, Deb, and why it is so emotionally charged and complicated, is that when you talk about numbers like those that the American Academy of Pediatrics just released about the number of confirmed cases, understand that those statistics represent real children. And as we know as parents, that is a completely different, rule set than when we talk about adults even. And so our tolerance for risk as individuals may be very different than how much risk and uncertainty and fear we're willing to accept and tolerate when it comes to our children. And that, by the way, goes also to the part of superintendents and educators and governors and mayors and politicians who also have to weigh in on this decision. So it is complicated. Dr. Fauci has said multiple times, this is not a one-size-fits-all equation. It's one that will need to have the flexibility to be able to pivot and adapt and respond to changes in real time. I don't think we should be surprised when we hear of cases. It's more how many cases, over what period of time, and how we will respond to those cases. And we also have to think of the ripple effect here. It's not just the children, but it's the households in which they live. It's the faculty and students, and about a
They come
quarter
up
of
against
them
adults.
now. That's right, and it's now been recently reported that a quarter of school teachers live with a pre-existing or underlying medical condition that may put them at increased risk. And so there's a saying in emergency medicine services: is the scene safe? You do not go in to rescue someone else unless the scene is safe for you. And we don't know yet across the board whether this scene is safe, but it's also important to remember, to bring it back to the medical, there is no such thing as zero risk. Children can and do die every year of influenza. They die of meningitis. So this is not only about this virus. It's just that is getting the lion's share of attention with good reason at this time.
And there also, even amongst these studies, there are kind of conflicting reports. I mean, there is one study that says Latino children are 8 times more likely to be hospitalized, Black children 5 times more likely to be hospitalized than, say, their white peers. So then you have other concerns too out there amongst the school population and for those parents.
There are differences within the specific demographic population, Deb, and there's also differences just in the educational population. There are children with disabilities, children with special needs that are also a specialized, unique group that need to be considered here. They've gotten almost no attention publicly and in the media on this issue. And so this is an absolutely complex decision that cannot be made with the flip of a switch. We just don't have all the right information at this point, and we don't have the testing capability right now to be able to mitigate the risk in cases or cities where they are seeing incredibly high rates.
And I've heard you on multiple occasions say, as doctors, there's no harm in saying we don't know because this virus is evolving. Richard, let me ask you, we've been talking about the patchwork of guidelines around the country. We have some states that are almost fully open, some states that are beginning to open, some that have actually started to close back up again because they've seen a spike in the number of cases. So, when we look historically at trying to defeat a pandemic, how difficult is it when you don't have a national policy and you have this patchwork of guidelines and one state doing one thing and another state doing another, and also the American psyche maybe not even taking this in the way that it could.
Right, very individualistic, and that's sort of a difficult thing. It may be more easy in a culture that is more society oriented. But actually, what worked best, I hate to say it, in the past to get unified action was a horrifying epidemic. So cholera in London in the 1840s. It suddenly provoked people to take pollution, water pollution, and contaminated water lines seriously. And the city then invested heavily in building. And London then became the example for the world, for the United States particularly, and elsewhere, that you had to take this stuff seriously if you want to prevent disease. I think what we need to do now, I saw an Associated Press report yesterday that since 2008, we have lost 38,000 state and local public health jobs. People resigning under pressure because people have not taken pandemics seriously. And we need to fix that. So there's a saying that it's better to have a fire department already built than to try to fling it together when your house is already burning down. Well, we need that fire department, and that means not just doing it on the national or the state and local level and the national level, but it also means investing in public health internationally. So in the course of the story for National Geographic, I met this great character named Michael Callahan, who's a kind of Zelig of infectious disease. Wherever there's been an outbreak, really the worst diseases from Ebola on over the past 20 years, he has been there with these other, what he described as high energy, compressed speech people. And he said that the kind of things that work are, they're not necessarily dramatic. So he said helping other countries meet their public health needs, even countries that aren't necessarily friendly to us, really works well. So in Indonesia, in about 2005, there was an outbreak of an avian flu. And Indonesia really depended on its poultry trade because its fisheries had been destroyed, and it's a Muslim country, so they don't eat pork. So his group, he worked for DARPA at that point, the Defense Department's Advanced Research Branch, and they went in there and they equipped Indonesian physicians with gene sequencing, and they worked hard to upgrade so that they were independent of the West, independent of the United States. And that got them from veterinary disease monitoring into human disease monitoring. And you have to have that kind of capacity, that kind of access in these countries all over the world, because that's where emerging diseases emerge. And he said one other thing, that it's important to build lifelong relationships, starting with young doctors who are working on infectious disease, and build their careers and put their names on articles in scholarly journals like yours, bring them to US schools to improve their education, and build them up in their countries so that then they feel like you're a trusted ally. And in one case, he did that with researchers who had in the Soviet Union been working on chemical weapons, and they switched over to working on public health and infectious disease. And one result of that was that that H1N1 avian flu that was coming, I think it was 2005, it was coming up through Siberia, and these guys alerted the United States so that public health workers could go to Alaska, screen the migrating birds who were coming up the western side of the Pacific and across, and make sure that that pandemic did not, that disease did not get into this continent, because it can not only destroy wildlife and avian and poultry, but also it can kill young people by destroying their lungs.
But of course, the will of the people to actually listen, to follow science. Mayor Bowser, we know that Dr. Fauci and all the other experts, infectious disease experts, continue to tout mask wearing, social distancing, of course, hand washing, all of those great recommendations for staying safe. But the mask wearing has become an issue in a lot of regions of the country. Where does DC come down with mask wearing at the moment? Because some places have actually mandatorily required them, some places have made them optional. Where do you come down on masks and how do you enforce it?
We have a pretty far-reaching mask order. Basically, what we've recommended to our residents is when they leave the house to wear a mask. Specifically, the mayor's order says that if you can't socially distance, then you should have on a mask. Enforcement is a tricky thing. You know, there's 700,000 people who live in the district. If they all decided that they wouldn't comply, then it would be unenforceable. But largely, I would say our residents and business owners have the ethos that we're going to protect each other and stand with each other. So our mask ordinance, by and large, is being followed. Now, there are some notable exceptions. And we struggle with making sure that our enforcement, which could be enforced by the police and with a fine, is proportionate to the problem that officials encounter. But the bottom line is, it is going to have to be, if we want large compliance with mask wearing, sending the signals from the top and doing it consistently across the United States of America is the most important thing we can do.
What worries you most right now as we try to get a handle on this virus and we continue to see the numbers ticking up? There is one estimate that we may see 300,000 deaths by the end of the year. As Dr. Ashton said, we don't know about a vaccine yet and whether we're going to actually have a viable one by the end of the year. As a leader, what worries you the most at this moment?
Certainly we're worried about health and getting control of the virus, but what this virus and the shutdowns have done to cripple our economies is, I don't even know if we can fully appreciate it. I can go to parts of downtown DC that are totally closed. People don't know when they're going to report back to their offices. We're not sure when kids are going to go back to school. Restaurants and small businesses shuttering. We don't know if people are going to have the unemployment assistance that they need. Already, millions of people aren't paying their rent. And what is that going to mean for affordable housing production? So, bringing our economy back is a huge part of what we all have to be focused on, in our country. People who have done nothing wrong don't know how they're going to put food on the table or don't know how they're going to pay rent. Landlords who have done nothing wrong also don't know how they're going to make mortgage payments and continue to be able to provide affordable housing. So I think we all have to be focused on people who've lost everything in this pandemic, and how, as a country, no local government, no state government is going to be able to fill that gap. So how are we as a country going to be able to make sure that those of us Americans who've been impacted by this virus can survive economically?
And
And
as we go
Deb,
forward,
I just
Sikan, there's been some talk about herd immunity. What in your
Mhm.
reporting have you learned about how we as a group begin to try to recover from this in that way, and that we can actually feel safe eventually, even though we may still have this virus amongst us?
Yeah, I mean, I think the first thing to say about herd immunity is that if we want to achieve it, we really need a vaccine. I think trying to achieve herd immunity through natural infection would be devastating. I think you would have, much more death than we've had now, and you'd have, way more people with, these chronic long hauler conditions that we're starting to see. So really, if we want to get to herd immunity, we need a vaccine. Based on some statistical analyses, it's thought that we probably need about 60 to 70% of the population to be vaccinated in order to reach herd immunity. It could be up to
Can you
80 or
kind of
90
explain
percent.
exactly what herd Can you explain for those who don't know what herd immunity really is?
Yeah, absolutely. So herd immunity is the idea that if enough people in a community or a population are immune to a disease, it'll break the transmission chains. It'll break the ability of the virus to spread from person to person. So for measles, herd immunity, or for the measles vaccine, herd immunity is about 80 to 90%. For mumps, I believe it's about 70 to 80%. We don't know what that benchmark is yet for coronavirus, and it'll probably take some time to figure it out. But if we really want to get this disease under control, we will likely need herd immunity. If we really want to go back to the way things were, we will likely need herd immunity. Until then, we really need people to follow the public health guidance that's being recommended by our top experts like Dr. Fauci, because it is possible to break the chains of transmission just through social distancing, through mask wearing, through locking down sort of some high risk activities. I mean, that's what we've seen in South Korea. That's what we've seen in New Zealand. That's what we've seen in Germany. That's what we've seen to some degree in DC. I think DC has been pretty good about being able to bring its caseloads down to a situation where we are in phase 2 right now, where we are able to dine out to some degree in restaurants and have some semblance of normalcy returned.
I was just going to dovetail on something that Mayor Bowser said before, because as she talked about the economic and social ripple effects of this pandemic and this virus, I think that's a really good metaphor for how we also have to think medically, and how I know every mayor and governor is thinking, which is it's not just about the virus that's a concern right now. Understand that just medically, people don't stop having heart attacks or strokes or car accidents or developing appendicitis just because we're in the middle of a pandemic. So if our hospitals are underwater and they're at or over capacity, and you have a heart attack or chest pain and you can't get the proper medical care you need because everyone is focused on treating COVID patients, that literally affects everyone. So in medicine, you always have to remember to take a holistic or 360-degree view, however you want to look at it. Look at the whole organism and body, not just a body part or a disease, and understand that the ripple effects of this virus medically, economically, socially, politically, educationally are massive. And it's a lot more than just the case count or the test positivity rate or, unfortunately, the death count. It's something that has the absolute potential to affect every single person in this country, whether they get infected with COVID or not. So as a physician, that's what we look at. That's what public health officials are concerned with. That's what politicians and leaders are concerned with as well.
And that's what I think concerns a lot of people too, because it's still time still marches on. And now here we are approaching Labor Day, the typical time when people are going back to work and back to school. We have an election coming up. Dr. Jen, speak to voting, if you would, because there are a lot of people who are worried about going out. Is it safe for them to actually think about going out to the polls to exercise their right to vote? We've seen all of these almost comical drawings of people in hazmat suits from top to bottom going, kids going to school, other people going other places. Is it safe for people to start thinking about resuming some of these things in the midst of this pandemic at this moment, particularly going out to vote?
Well, the question you ask is really, how do we stratify risk? And some doctors don't do that very well, let's be clear. So it can be incredibly challenging and daunting for a layperson to do that. So, I have a saying that I use all the time on the air and in my real practice, which is I would much rather teach someone how to think like a doctor than teach them a fact that today we might think is accurate, and tomorrow we might learn something new and learn that it's out of date or inaccurate. So how to think like a doctor when it comes to weighing risk is ask yourself 4 questions, not 2 questions, not is something safe, yes or no. That's 2 questions. The 4 questions are, what is the risk of my doing this? What is the risk of not doing it? What's the benefit of doing it? And what's the benefit of not doing it? So everyone will have to answer those questions for herself, for himself. Again, it's not a one size fits all discussion or thought process. But when you talk about, is it safe to go out and vote? It depends. Are you a person who's over 70 years old, who's black or brown skin with obesity and diabetes, living or voting in a hot spot? Maybe you would say, no, that risk is unacceptably high when compared to the risk of staying home. But then this is complicated by what are the benefits of doing it? So it's those 4 questions that people should be in the habit of asking when it comes to any question in medicine, in this case, in life, because you can usually make a box, put your 4 answers in list form in that box, and get a pretty good idea of whether you should or should not do something.
Richard, do we just have to accept the fact that we are going to be living with this virus for a long time and we have to sort of sort out the risks and the benefits and how we go forward just in life? I mean, when you look historically, these pandemics did not, go away quickly. They lasted for long periods of time. So do we just have to accept that we have to just deal with the novel coronavirus for quite a while and make peace with that?
In the past, certainly people did. Tuberculosis killed 1 in 7 people in the 19th century, and people just expected that. They even romanticized tuberculosis. It's a little weird. So, yeah, we might well be stuck with this, and we might also face other emerging diseases that we don't even begin to suspect right now. And I think that, rather than resignation, the answer is to start spending what we should have been spending all along in public health. And it will be expensive, and it will be expensive at a time when our economy is in bad shape. And yet, it's way cheaper than allowing a pandemic to occur. We have so far, national and world governments have spent $8 trillion on COVID. And we really do not want that to happen. We want to get past this one, and we do not want to happen like that again.
And Dr. Ashton, going into the fall and the winter, we know that we expect flu and colds and all of that, and then maybe possibly another spike in COVID-19. What's your best guess?
I think all of us on this panel are going to be following that and have an eye on that for sure. Sometimes there are unexpected silver linings, even in the grimmest public health global pandemic scenarios. And one of them that we are in some ways almost keeping our fingers crossed for is that all of these aggressive, we call them NPIs, non-pharmaceutical interventions like mask wearing and hand hygiene and distancing, staying home or isolating if you're sick, we really do expect them to have a positive impact on flu rates this year. However, again, no one has a crystal ball here. And as you said, the people who say they have the answers when they're looking down the road generally don't. We've never been in this situation before. So I think we have to recognize and admit what we know and what we don't know. But you can make some hypothetical guesstimates. And one of them, of course, is that we may see less flu. But to be crystal clear, there is a big concern in our healthcare system in this country about being inundated with 2 highly transmissible respiratory pathogens, at the same time. And we just have to wait and see how that pans out.
Mayor Bowser, you've been in office about 5 years now. Has COVID-19 been your biggest challenge thus far?
For sure. I would say I haven't met a single person who ever imagined that we would have a situation where we had to shut down our whole city and deal with a global health pandemic. And it is lasting a long time. And so dealing with that, along with the racial reckoning that is happening in our country, and especially in Washington D.C., kind of at the doorsteps of the Capitol, we've been confronted with just a massive response, the public health response, a public safety response, and looking towards an economic recovery that's going to be very important for us. Just to understand the swing of what happened to us, just when COVID hit, we were preparing to send our budget to the council. To our council for approval. And we had to completely redo our budget because we experienced an $800 million revenue decline for this year, for this fiscal year, and another $800 million for the next fiscal year. So we had to totally rework our budget to get those things done. We are in a better position than most jurisdictions. However, we were able to balance our budget using reserves, trimming some programs, and still investing in our priorities. But we know if this continues, we won't be able to continue that. Another thing that's been highlighted by COVID is the great racial disparity in how the COVID fatalities, and that is really borne out in Washington, D.C., where we have over 70% of our fatalities related to COVID are all African Americans. And so really looking at the disparity in health outcomes in our communities has to take a front seat. And we know it's more than insurance because most of our people are insured. It has to do with access to specialists and proper care, but it also has to do with some disparities that we know exist in our healthcare system to start, and how we nationally and locally take on those disparities is going to make us all resilient. But that's a long answer to your question. Yes, this COVID pandemic and the effects of it are by far, I think, the biggest challenge for any local leader.
And as a leader in charge of guiding and trying to protect citizens, your biggest message right now to all of us?
Well, my biggest message is that we have to continue to look out for each other. And when the scientists told us that staying at home and social distancing and hand hygiene and staying home when sick would work to blunt the curve, they were right about things. And so we still have to continue to follow the science and scientists and do the things that are going to keep our whole community safe. And that means sacrifice now for getting back to normal sooner.
This has been absolutely informative and enlightening. And thank you all so very much for joining us and for your individual work in trying to help fight this pandemic. On behalf of National Geographic and myself, I thank you so much, panelists, for being here. And to those of you at home, thank you for joining us. I'm Deborah Roberts. And if you want to learn more about National Geographic's COVID-19 coverage, you can go to the website natgeo.com/coronavirus.